One of the things I love about the Summits for Clinical Excellence is its eclectic group of presenters that they bring. They're incredible, engaging topics from trauma to mindfulness to neuroscience to addictions to depressions to some of the leading topics that face all of us today. Clinicians from around the country come to learn from these exceptional thought leaders. And as a co-host, as somebody who's been with the Summits for a long time, I'm always engaged in the process and really appreciate the clinical depth of what they have, the way they produce the conferences, and also the exhibitors from around the country that showcase what they have to offer. Phenomenal speakers, some of the leading minds in this field, from the people who have been here from the very beginning, like the Bradshaws, Vander Kolks, to some of the newer neuroscience presenters that come here, to embracing things like mindfulness. So it's really an eclectic group of individuals. It spans kind of the time of addictions, behavioral health treatment in our industry. So the Summits tackle some of the most current issues with some of the greatest minds of our industry. We have people like Dr. Colin Ross, who talks about trauma or dissociative identity disorder. We have people like Harville Hendricks, Dr. Hendricks, who talks about relationships. We have Bessel van der Kolk, who talks about trauma. We have Dr. Carolyn Ross on eating disorders. We have some of the greatest minds, mindfulness. We have Dr. Hansen. I mean, we span the spectrum of behavioral health and addiction and what's leading and where did it begin. It's an amazing eclectic group of individuals that we're lucky enough to have here. And they talk to us in a way that we can integrate, understand, and be on their level at the same time. The Summits for Clinical Excellence are by far the best conference out there. I mean, they've been going on now for over 15 years, and with that clinical depth that they offer, the incredible locations, with the speakers, with the group of individuals that come here as a community, it's phenomenally well run. People are engaged. They come over and over and over to come to these summits. No matter where they are around the country, people come to the summits because they're different. It's a feeling, it's a community, and they learn from the greatest minds. And Paul Ortman has a knack for putting the best people together in the best locations at a great price, and it's phenomenal. One of the things I love about the Summits for Clinical Excellence is how they embrace the exhibitors. We're not just stuck in some small part of a hotel, but we're brought into the whole picture. We're part of the whole community. And participants are encouraged to interact with the exhibitors. We do everything we can to interact with the participants here and the speakers with multiple opportunities to engage with them. People don't feel like we're being pushed on them. They feel invited to attend these exhibitor meetings. It's a phenomenally engaging process, and one that we're put on the same platform as the presenters and as the community that comes to us. It's all even. I've met some of the greatest therapists, incredible caring people, passionate people at these summits, people who exhibitors want to meet, people who we can work together with to help clients. It's not, the summits do not bring about people who will not be of value to the different resources, the different exhibitors, the different treatment centers. Paul Ortman and his staff have a knack for bringing together great presenters, great community, therapists, psychologists, psychiatrists around the country who can utilize the exhibitors who are here participating. It truly is a collaborative effort where we have great clinicians that then attract incredible therapists, psychiatrists, and psychologists from around the country, people who are at a higher level that will engage with the presenters. These are the people that treatment centers want to meet with, want to talk with, and want to spend dollars on to educate about their programs and facilities. And Paul has an incredible knack for putting this all together. There's so many pieces to this puzzle, whether it's the presenter, whether it's the venue, and then who he's trying to attract to these events. And these events bring the people that we as treatment centers want to engage with, because we can work together mutually to the benefit of our patients.